Hello everyone. Today's video is about, well, someone who has a history of a lot of different test results indicating different infections. And so anyways, I'll just read the question. It'll make more sense. Kind of hard to give a concise title for this one. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. And if you don't mind taking a quick moment to like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So the question is, let's see here. I have been diagnosed with chronic fatigue syndrome and chronic myopericarditis. I am often positive on IgM, which is a type of antibody for Epstein-Barr virus. Also for a year, I think there's some autocorrect challenges here. Let's see here. So also for a year, IgM Western blot was positive for Borrelia, Afzelia by the looks of it, and then looks like, anyways, it's on some kind of IV therapy, but looks like autocorrect kind of botched that. And then so, but then, oh yes, it was treated with IVs for some time, and then the IgG results were negative, so she was told she didn't have Lyme anymore. Now she's positive for Mycoplasma pneumonia with both IgM and IgG antibodies, and also with Candida IgM and Aspergillus IgM antibodies. I have extreme fatigue for years and started to get a dry cough. I just wanted to ask if it's possible to connect symptoms and my problems, and could Mycoplasma pneumonia be a false negative? Which I thought she said that it was that it was positive. So okay, so anyways, a little bit of a winding question. So thank you for the question. The reason that I wanted to answer this question in part, and kind of when I read through it the first time, I was like, okay, this is kind of a little bit winding. One of the reasons that I wanted to answer this question is because one of the things that it's really easy for clinicians and patients by proxy to kind of get hung up on is what different antibody tests are saying. And where it gets really tricky, especially with something like, say, Mycoplasma pneumonia, for example, Mycoplasma pneumonia for some people causes, chronic debilitating symptoms. For some folks, Mycoplasma pneumonia doesn't really cause more than just, regular old cold, upper respiratory tract infection symptoms. For some people, it'll cause kind of this quote unquote walking pneumonia, as it's called. People just have these lingering respiratory symptoms and feel just pretty crummy for say several weeks on end. And then for some people, it causes debilitating issues for years and years. So where it gets a little bit sort of confusing is that we'll run a test, we'll see, oh my gosh, there's antibodies against Candida, oh my gosh, there's antibodies against Mycoplasma, oh my gosh, there's antibodies against the Lyme bacteria, and these are things definitely to pay attention to, but we always have to contrast it with, well, what's actually happening clinically with the patient, especially when it comes to antibodies for the Lyme disease causing bacteria. Those can persist in a person's body for years after the infection's been resolved. Candida antibodies, I mean, I haven't seen any compelling research literature telling us what the definitive relevance is of Candida antibodies. I mean, we all have Candida in our bodies. We have it on our skin, in our sinuses. We have it in our intestinal tracts. Females have it in the vaginal canal. There's Candida all over the place, and so it's something where if we have antibodies against Candida, it's like, well, what exactly does that mean? And so if the patient came to see me and they had anti-Candida antibody levels that were elevated, but they were generally feeling good, they were just maybe doing some health screening testing or something and had elevated antibodies, they say, well, do you have digestive issues? Do you have Candida rashes? Do you have a bunch of sinus symptoms? Do you have sugar cravings and things like that? Things that would suggest that there was a Candida related issue, like a Candida overgrowth, if there vaginal irritation, things like that. And if the answer was no to all of those questions, I mean, maybe we'd follow it up with, say, a stool test to see if maybe there's some intestinal yeast like Candida overgrowth. But it might just be that it's the immune system's just reacting to Candida that day, and there's some elevated Candida antibodies or the antibodies persist more than just on a day-to-day basis, but it may have been there was some triggering event. Say the person ate too much spicy food, it caused a little bit of gastrointestinal irritation, a little bit of candida antigen escaped into the tissues surrounding the intestinal tract, and then some antibodies were created through kind of like a transient leaky gut type phenomenon happening there. So if a patient came in to see me and they were feeling generally well and they had elevated mycoplasma antibodies, IgG or IgM or both, then I would look at that and say, well, maybe for good measure, we put them on some antimicrobials just for good measure, but I wouldn't be thinking like, oh my gosh, like this person has this, crazy infection that we need to do something about. It might really just be an indication like, yeah, if you were exposed to that bacteria, it's not a big deal. Now this patient or this individual online, who's I'm sure a patient of someone, they indicated that they're having all these symptoms, and so it's like, okay, so there's positive lab findings and there are symptoms. Okay, that's a different kettle of fish. But the way that I would approach the way I approach laboratory information like this when I'm working with patients, say, who have chronic fatigue syndrome, is that, well, yeah, we see these antibodies that are elevated. We should probably try working with some antimicrobials. But if those antimicrobials aren't making a big clinical difference, like again, the autocorrect, I think, kind of botched the question a little bit. But whatever those IV antibiotics were, or the IV treatment was that was mentioned here, that led to normal looking test results afterwards for Lyme. It's like, well, how does that make a person feel when they're treated with systemic antimicrobials? It's like, oh, I felt so much better, but then the treatment stopped and I started feeling worse. Well, that would be compelling evidence to say there's probably still some microbes kicking around. Something should probably be done about that. But if a patient's been treated with antimicrobials thoroughly and they're still having symptoms, at that point, I don't really care a whole lot, or I shouldn't say I don't care. I put way less weight on those lab tests, saying like, there's some evidence of maybe there's some mycoplasma, maybe there's some candida. It's like, well, whatever might be systemic that kind of drove those antibodies to be elevated in the first place, it might not actually be driving their symptoms. I've had plenty of patients over the years who will run comprehensive testing. We'll see, oh, there's evidence of this, that, and the other microorganism. We'll put them on antimicrobials and just they don't improve clinically at all. And sometimes we'll retest afterwards, be like, oh, maybe these are just really resistant microbes. Maybe there's biofilms, this and that. We'll retest and see, no, your levels look totally normal now. There's no evidence of infection, and yet they didn't feel any better from the treatment because, in hindsight, it was due to mold toxicity. It was due to elevated heavy metals. It was due to amygdala dysfunction. It was due to mitochondrial insufficiency, whatever it happened to be. So kind of, again, main reason I wanted to put this video out was because I think it's just important not to get too hung up on the labs. It's easier said than done, especially from the patient perspective, because somebody listening to this might be thinking like, I spent a lot of money on these labs, and you're saying like, wow, maybe they're not all that worthwhile. I'm not saying that at all. I think the data that we get from labs is important, and we run labs all the time, but it's important to remember what the limitations, or to be aware of what the limitations are of those labs, what the labs are actually saying. Are they, saying, yes, there's a definite infection, or that there's been exposure in the past, and maybe there's still ongoing infection, but then really what kind of trumps everything, in my opinion, is what actually happens clinically when the treatment is undertaken. And if a patient's gone on systemic antimicrobials and it haven't really made a difference, then it's very likely that there's something else afoot, or maybe something in addition to those microbes. So it's all very complicated, all very nuanced, but that's what I wanted to say today. So thank you again to the person who asked the question. I hope this information was useful. If anybody has any comments or questions on this video, please post in the comment section below, and I will do my best to answer as soon as I can.